Joining us live right now on WBZ this morning is Dr. Christine Crawford, a psychiatrist with Boston Medical Center and an assistant professor at BU School of Medicine. Dr. Crawford, thank you so much for joining us this morning. Mental Health Awareness Month is coming to an end, and it's been a really difficult week with the school shooting in Texas. Can you talk about how mass shootings are taking a toll on all of our mental health, even for those of us who are thousands of miles away?
Yeah, it's clear that over the last couple of years, we have experienced significant forms of trauma. And I think that hearing about this event certainly adds to all of the trauma that adults and young people have been experiencing. It makes people feel uncertain about their future, uncertain about their safety, and can create a lot of worries and fears already during a time when people are feeling quite uncertain about their future and unsafe. This certainly had a dramatic impact on people's overall mental health.
And so the news of this shooting comes on top of the shooting in Buffalo, on top of a pandemic and the horrors that we've been watching in Ukraine for months. What can we all do to cope with what's been going on?
I think it's important for people to talk openly about how all of these different events have been impacting their mental health. Given the fact that it seems like there's one event after the other, there's almost this expectation that we need to keep moving forward, keep pushing through, and act as though everything is normal and that things aren't having an impact on us. But the more that we can engage in a conversation and a dialogue about how all of these events so deeply, profoundly impact us, it allows us to connect with each other, allows us to open up, and provides that outlet that we all need, rather than keeping all of these things inside. And overall, later on, it can build up and really interfere with our ability to function day to day.
And so in the story before this interview, we heard from young kids and a teacher in Mattapan talking about their fears. So what can we do right now to support kids and parents and teachers?
So when it comes to kids, it's important to talk about how these events have impacted us as adults. To say things like, you know, I really haven't been feeling myself, been feeling more anxious with all of the recent news. And this is what I do in order to help manage some of the stress that I'm experiencing. How have you been feeling the last couple of days? If we can engage in those sort of conversations with our kids, that's a way to model how to think through and work through really challenging situations, and they can learn some of the tools and strategies that they need in order to better cope. And I think for our teachers, I think that we need to have a lot of compassion for what it is that they're going through. Even though they weren't present, it still profoundly impacts them. So allowing them to have space, allowing them to take time to reflect and to grieve. And so knowing that they may need the space and time to heal, it's important that we offer that to them.
All right, that is really, really valuable advice. Dr. Christine Crawford, thank you so much for taking the time to join us this Saturday morning.
Thanks for having me.